Nymph virus encephalitis. Nymph virus encephalitis. Introduction. In September 1998, in the village of Empang, case of fetal febrile encephalitis in human following respiratory and encephalitic disease in pig. Initially diagnosed as Japanese encephalitis, in April 1999 named as Nymph virus after the place from which it was first isolated. The outbreak of viral encephalitis lasted 35 weeks, 29 September 1998 to 31 May 1999. Of the 265 cases reported to the Ministry of Health in Malaysia, 105 were fetal, CFR 39.6%. The outbreak also spread to neighboring Singapore, where 11 workers in an abattoir developed the disease with one fatality. Pig acted as an amplifier, aerosolizing virus and infecting human. Timeline 1997 Nymph virus entered the pig population in Malaysia, causing a respiratory and neurological illness. First case and death in a pig farmer in Prague. 1998 Formal recognition of start of outbreak. Outbreak spread south. Health Minister declared it JE vector control and vaccination. 1999 spread to Singapore abattoir workers. A new paramyxovirus discovered and named Nymph virus. In May outbreak and in Malaysia. 2001 first outbreak in Bangladesh and India. 2002 virus isolated from bat urine and partially eaten fruit. 2003 outbreak in Nagaon, Bangladesh. 2004 outbreak over a wide area in Bangladesh. Person to person transmission reported. 2005 outbreak in Tangail, Bangladesh. 2006 Siliguri outbreak in India ascribed to Nymph virus. 2007 outbreak in India and Kustia, Bangladesh. 2008 currently an outbreak is ongoing in Manikganj and Rajbari, Bangladesh. Etiology 18 March 1999 the CDC paramyxovirus related to Hendra virus. 10 April 1999 called Nymph virus Songhai nymph in Nigeri Sembilan. Genus Nipah virus. Genus Nipah virus related to Hendra virus. Family Paramyxoviridae. Order Mononigavirales. Single stranded RNA negative sense. Virion enveloped helical symmetry 10,000 to 10,040 nm long, 40 to 600 nanometer in diameter, spherical filamentous or even pleomorphic. The virus possesses G protein H, HN and fusion protein F. Virus has a wide host range. Reservoir of the virus. Reservoir of the virus. Fruit bat, Toropus natural reservoir. Seroepidemiological study in Malaysia implicated for fruit and an insectivorous bat. Virus isolated from polluted urine of P. hypomelanu or Taiwan Island, Malaysia. About 60 species of flying foxes. Mode of transmission. Primary bat transmit virus to pig which infected human. Pigs act as secondary host and amplifier. Pig infected by partially eaten fruit, urine, feces or fetal material of bat. Pig infect human by shedding viruses in secretion. Low risk transporting pig may also have introduced the virus onto farm. Vehicle borne fresh dead palm shape contaminated by bat. Human to human spread established Bangladesh, India. Nosocomial infection in Siliguri, India 2001. Infected dogs and cat and sharing of boar semen. Cat were infected with the virus at the site of outbreak in Malaysia and shed it through nasopharynx and urine. by use of infected syringe of vaccination, transmission of by Nipah, infected vet, infected fruit, infected pig, infected human. Indian scenario: Siliguri, 2001 January 31 February 23, 66 case with a 74% mortality rate, 45 death. Human to human transmission reported. 75% of patients were either hospital staff or had visited one of the other patient in hospital. No report of contact with pig. Nadia, 2007 February May, up to 50 cases with 5 fatality. Bangladesh, Meherpur, 2001 April May, 13 cases with 9 fatality, 69 mortality. Nagaon, 2003 January, 12 cases with 8 fatalities. Ganj and Rajbari, 2004 January February, 42 cases with 40 fatalities. Faridpur, 19 February 16 April 2004, 36 human cases, 27 deaths. 92% case in contact with at least one patient. Human to human transmission. 6 cases involve acute respiratory distress syndrome. Tangail, January 2005, 12 cases with 11 fatalities. Virus contracted from drinking dead palm juice contaminated by fruit wet, dropping or saliva. Kustia, March April 2007, 8 cases reported, out of which 5 fatal. Manikanj and Rajbari, 29 February 2008, 9 fatality and 10 serious cases. Thailand and Cambodia. New virus has been isolated from Petropus bat in Thailand and Cambodia, but no disease outbreak in animal or human till date. Clinical manifestation: bat show no sign of disease, though agents shed in urine and saliva. Swine, barking pig syndrome or one mild cough. Disease varies with age. Suckling or young pig coughing, open mouthed breathing, abnormal posture, convulsions. Nymphovirus infection, asymptomatic or mild symptoms, late onset or replace encephalitis, acute encephalitis syndrome symptoms, subsequent death, massive cerebral hemorrhages. Horse, 1 death from encephalitis. Dog, distemper-like sign, fever, respiratory distress, ocular or nasal discharge. Cat, fever, depression, severe respiratory sign. Diagnosis: history or clinical sign, virus, isolated kidney, liver, cerebrospinal fluid, electron microscopy, histopathology, immunohistochemistry, lung, kidney, spleen, heart, RT-PCR, IgG, IgM capture, ELISA, serum neutralization test. SNT is accepted. Reference serological test. BSL-4 level agent show work be carried out in a PC4 facility. Treatment: effective treatment has not been developed. Intensive supportive care. Ribavirin may reduce mortality among patients with encephalitis. Polyfast policy 12U, an interferon inducer, was found to be effective. Monoclonal antibodies have been used experimentally. Isolation of infected human. Prevention and control: immediately contact state authorities. Avoid all contact with potential infected pig. Total ban on the movement of pigs from the infected area and immediate culling of the animal. Chlorinated lime detergent used to disinfect premises. A total ban on porcine production. Strict hygienic measure, medical personnel by wearing glove and mask. Surveillance program, financial assistance, educational program to highlight the danger of the new pig disease as well as to practice good animal husbandry for the farmer and wearing of appropriate attire. Piggeries should be shooted far away from orchard. Public health issue. Mass culling mass culling causes substantial economic loss to the industry and national economy of the affected country. New virus can infect human with very high CFR. Nearly 50% of survivors have brain damage. Bangladesh outbreak had a foodborne route. The organism is replaced in BSL4 agent can be used for bioterrorism. No effective treatment or vaccine for the disease in either pig or human. Little is known about Nipah virus. Conclusion: the disease led to killing of 1 million pig and 100 human deaths in Malaysia alone. But the natural reservoirs have a wide geographical distribution. No effective treatment or vaccine. Need for early and short diagnosis, proper surveillance and development of vaccine. Thank you.